Welcome to today's edition of the IntoTexas AI podcast. It's your look at AI news and trends impacting Texas. I'm your host, Shannon Ballou. Let's get started. Today, we're starting with a big win right here in North Texas, where Dallas-based Spectral AI has just been recognized with the Small Business Innovator Award at the inaugural Texas Innovation Conference held at TCU. So we're sending big congratulations to the company and thought this would be the perfect opportunity to take a closer look at a Texas-based company and AI in healthcare. So the work that Spectral AI is doing, along with all the recognition it's receiving, look, it's further validation that AI-driven healthcare innovation is moving from research into real-world clinical impact. And Texas, as often is the case, is right in the mix of making it all happen. So let's look at the award, the recognition, and the win for all of us. The Texas Innovation Conference brought together startups, researchers, and even investors that are focused on turning innovation into real-world impact. And obviously, Spectral AI stood out. It takes AI out of the lab and puts it directly into clinical decision-making. So the company uses a combination of things to make this happen, such as something that's called multispectral imaging, and then proprietary AI models, and then it takes a real-time predictive analysis of the situation. And it's all done to answer a simple but really critical question, which is, will this wound heal or not? Historically, that decision has relied heavily on physician judgment, and now it's becoming more data-driven, more immediate, and more precise. Spectral AI, as we said before, it's a Dallas-based predictive AI company focused on wound diagnostics. And in particular, it's getting known for its DeepView system. And this analyzes massive data sets of wound images. And then it detects patterns invisible to the human eye. And then it delivers more objective predictions in real time. So that equates to a significant advancement for clinicians because earlier and more accurate insight can, as we would think, right, reduce unnecessary surgeries, speed up treatment decisions, and improve overall patient outcomes, which is the end goal, right? So the company is already advancing toward commercialization with an FDA pathway underway. And again, it's not theory anymore. This is truly clinical grade AI entering real world workflows in the best possible way. Other things of interest about Spectral AI, it is a public company, still relatively small, I guess considered early stage when compared to many of the healthcare giants out there, but heavily supported by government funding and critical partnerships. I should also mention that the award at the TCU conference has not been its first recognition. Time magazine, in particular, also named Spectral AI to its list of world's top healthcare companies in 2025. That's huge. So I think it's fair to say that Spectral AI is really truly at the intersection of healthcare innovation and AI commercialization. And that's a really powerful place to be, especially in a state such as Texas, where we're investing heavily in both healthcare and AI ecosystems. Now let's talk about the bigger shift, AI and Texas healthcare, and look at what's happening inside the state in particular. As of 2026, healthcare AI in Texas has really moved from pilot programs to integrated clinical infrastructure. And two, what I would think are common forces probably driving a lot of this is clinician burnout. And again, similar as to other industries, which is workforce shortages. And here's what that looks like on the ground when you talk about healthcare. Some recent statistics that we found, 75% of U.S. health systems, including many in Texas, are now using at least one AI application in some way. And many are deploying multiple solutions across clinical and administrative workflows. One of the fastest growing categories, well, something called ambient AI scribes. So these are voice to text systems that automatically generate clinical notes. And again, some of the data that we found said that 68% of healthcare organizations are adopting them nationally. Institutions like UT Health San Antonio are already using them to reduce documentation burden. Although using agentic agents for scheduling is another area of need from a management standpoint. And in fact, it just so happens earlier today, I was on a LinkedIn Live broadcast from Oracle talking about their new Fusion agentic applications that they've introduced. And they used one of these exact types of examples for how agentic AI is changing not just workflows, but truly real business outcomes. And so they were talking about how nurses are having to manage intensive schedules at hospitals and how agentic AI can really help save so much time, so much labor, and free them up to, again, focus on patient care, which is where we want them, right? As people that are going to benefit from the work that nurses and doctors and others in the medical industry do. We want them focused on our healthcare and not on administrative activities. So just interesting coincidence from today. But obviously, there are so many areas where AI is already changing healthcare for good. Another example is AI used in radiology, where you have more rapid case prioritization. So, for instance, AI might analyze CT scans to detect really critical issues and then instantly move those cases to the top of the radiologist's work list. So they get to the most important cases faster and can help get those people more faster care as well, right? And then you've got faster and better imaging. So AI tools can reduce MRI scan times by up to as much as 75%, while also improving image quality. There's also the example of cancer detection assistance, where AI algorithms, such as FDA-cleared mammography tools, can assist in detecting very subtle signs of early cancer, such as in breast imaging, lung nodule classification, or in general chest x-rays. You also have image reconstruction as an example, where AI enhances the quality of images and reduces noise and radiation exposure for patients. That source, by the way, for all of those comes from the National Institutes of Health.gov. Well, let's look at Texas as a national test bed. The state is also becoming a testing ground for lots of national AI programs, and healthcare is no exception to that. So the Centers for Medicare and Medicaid Services, CMS, is currently piloting AI-powered prior authorization in Texas. And prior authorization it's long been a frustrating bottleneck in healthcare. So using AI, now they can accelerate approvals, reduce delays in care, and cut administrative costs. And in some cases, the research that we found noted that it cut costs by as much as 25%. That's huge. At the same time, I think it's important to note that Texas is investing heavily in infrastructure to support healthcare. So the UT system launched a $10 million Real Health AI initiative to unify data and AI capabilities across various institutions. You've got UT Dell Medical Center, which is building toward an AI native hospital model. And then UTMB is already using AI to identify patients who are missing evidence-based care. Again, this is coordinated system-level transformation, and it's happening here in Texas. Let's talk about regulation. And Texas setting the rules. As in other areas of AI testing and implementation that we've discussed a lot here in IntoTexas, we also see that the state is not just adopting AI, but also attempting to govern it for good. New laws that took effect in 2026 now require clear disclosure to patients when AI is used in diagnosis or treatment. You have human oversight required for all AI-assisted decisions in healthcare. And then there are restrictions on where patient data can be stored and processed. So legislation like the Texas Responsible AI Governance Act, or TRAGAS, it's also known, is setting a clear tone. AI can absolutely move fast, but accountability has to keep up. And that balance is critical, especially as adoption of AI accelerates. And in healthcare, it's really serious, right? You don't get second chances. So you've got to get it right the first time. And this is where I think we really see that partnership between government and regulation and implementation and deployment of real procedures is where it's so important that it merges. And again, there are just real risks here. In fact, a 2026 survey that we found said that 57% of healthcare professionals have used unauthorized AI tools, so-called shadow AI. Look, this is no different than in many other industries. But again, in healthcare, where we're all impacted by this, it's really important that we get it right. And that's innovation. That's an example where innovation is happening faster than governance when you've got all of these shadow AI tools being used. And we've got to tackle it and address it responsibly. And look, Texas is really trying to close that gap, I think. And that brings us back to Spectral AI and other Texas-based AI-focused healthcare companies that are truly trying to build clinical-grade AI and fit them into real hospital workflows and implementations, again, for the good of us as patients. And look, they're partnering for that regulation and governance that we talked about that's so critical. So we're getting a preview of what healthcare is becoming. It's predictive, it's data-driven, and it's increasingly being powered by AI at the point of care. So here's the takeaway. Texas, once again, is emerging as a leader in the country for real-world healthcare AI deployment. We're not just building it, not just funding it, but actually using it as we move to truly predictive, data-driven healthcare at the point of care. That's it for today's episode of the IntoTexas AI podcast. I'm your host, Shannon Ballou. Thank you so much for joining us again. And if you would like to continue to getting insights into how AI is reshaping Texas, then I invite you to listen, to share, please subscribe, and I'll see you next time. Thank you.